All right, thanks. Thank you. Thanks, Dr. Yamamoto. Okay, so thanks everyone for staying. I appreciate it. If you need to come and go, that's quite all right. Okay, so we already explained the Foxhall Foundation. If anybody has any questions, certainly let us know. We started this actually, I don't know, 6 or 7 years ago. We were working on a program to try and extend memory care and support, most importantly support, in our community. And we're still gonna try and do that. I think we'll try and do that next year. COVID slows things down. But at least for the foundation, we got this going. We have our nutritionist starting soon. More exercise classes and fitness classes. We had one book and we're working on another book. And so this talk is a little bit of the work in progress of the next book. So this is a work in progress, in particular the Pyramid of Health. Again, we've sort of went through this already. Nutrition coming soon, yoga, and we'd like to make a longer list of classes under Kenzendo Karate at the Wellness Center, so we're working on that. Pyramid of Health. So imagine this is a three-dimensional structure. Obviously, if it's two-dimensional, it's gonna fall down. So if this is a three-dimensional structure, these being the base of your pyramid, blood pressure, bone density, diabetes, arterial health, which was just discussed, ingestibles, we'll get to that in a minute. And then up at the top, this was developed a couple months ago, I put immunizations, meaning it's not the base of your pyramid, but I think right now we all realize that immunizations may be the base of our health pyramid. Thank goodness for Montgomery County. All right, ingestibles. What do I mean by an ingestible? Okay, so there's a long list of ingestibles. Does anybody know what this one is? It does not unfortunately project very well. It's bark. This is willow tree bark. So where else in this slide is there willow tree bark? Willow tree bark, aspirin, exactly. Somebody said aspirin. So willow tree bark is aspirin. A lot of our best ingestibles started as herbal products. So this, I did learn this from Dr. Yamamoto, it's true. So you could take a daily preventative ecitrin-coated aspirin for your heart, or you could peel off some willow tree bark and take it, but obviously this is a little easier. Echinacea, some people take echinacea. Some people take marijuana or CBD. We have topical formulations of marijuana now. This right here is kind of hard to see. It doesn't project well again, but these are all the food additives. E123, E122. Those are chemical compounds added to our food. So there's a long list of those. Remember, look at a label, see what those chemical compounds are. I had a patient who's told me, and I'm sure you've all heard this before, if you can't pronounce it, why are you ingesting it into your body? So think about it, look at your label, see what's there. Chances are it's some of these chemicals. We obviously also ingest pills, and for some of us, those pills are great, they're like this. For some of us, they might not be so great, like Motrin. If Motrin was put before the FDA today, it probably would not be an over-the-counter medication. Motrin, Advil, Aleve, the non-steroidal anti-inflammatories are great at getting rid of your arthritis pain. They're not so great for your stomach, they're not so great for your kidneys, and they're not so great for your blood pressure. So this is available over the counter, but it causes a lot of problems. Every week I have somebody who's in the hospital who might have an ulcer because they took too much Motrin. Even Debbie Dingle admitted that she took a little too much ibuprofen. She didn't know it's an over-the-counter medication. Why would you think that something that was supposed to help you with pain would end up giving you a stomach ulcer? So we have to be careful what we ingest. Thankfully, Debbie is okay.
Is that ibuprofen on the ulcer?
Yeah, Motrin is ibuprofen, is Advil. So they're all different versions of ibuprofen. Aleve is naproxen. They're all in the drug category of non-steroidal anti-inflammatory drugs. So doctors don't want to say non-steroidal anti-inflammatory drug all day, so we say NSAIDs. So when we're referring to NSAIDs, non-steroidals, they're not steroids. It's not prednisone. It's an anti-inflammatory, thankfully not prednisone for some people who can't take prednisone, but still pretty potent and can be dangerous. Cigarettes, I think we all know about the dangers of cigarette smoking. Artificial sweetener, saccharin. You have to look at the research on some of these artificial sweeteners. We know that for some patients, it's better to avoid sugar, but does that mean that this is what you want to ingest in your body? Especially when it comes to gastrointestinal problems. If you talk to your GI doctor, about your bloating, your gas, one of the first things they might tell you is eliminate all your artificial sweeteners from your diet, saccharin, NutraSweet, because those actually can be gas creators in your GI tract. So be careful about what you ingest that you think is better for you because it's not sugar. Yeah, that's true, it's not sugar, but what is it? And is it actually not good for your body and your particular digestion? Alcohol is just continuously controversial. So sometimes we'll tell you, and again, this is where patients get a little frustrated, understandably so. The recent study said I shouldn't be drinking alcohol, it increases my breast cancer risk. A recent study said I should be drinking 2 or 3 ounces of alcohol a day, it's good for my cardiovascular risk. This is something individualized and you really need to discuss it with your doctor. But again, it's an ingestible, so think about it. Okay, back to the pyramid. Arterial health was just discussed. The only thing I'd like to say, again, is to represent the same picture of the clogged pipe. Because for me, this image is excellent. Because I have the great fortune of working in an office where I can look at all your arteries every day, because the technology is sitting right next to my office, I can go and see somebody's plaque. So if Dr. Yamamoto, my friendly in-house cardiologist, says, look at this piece of plaque in this person's artery, then this is actually what I'm looking at. I'm looking at the clogged pipe, and he can show this to me. You don't want to be dirty on the inside. You want your pipes clean. Again, aging is inevitable. We're all going to kind of get this, but our new approach, I think, is to try and prevent this from at least accumulating that much. We want to keep an eye on this. Usually, for some people, it'll start in their 40s, but at least 40, 50, 60. We want to know how clogged are your arteries, hopefully not at all, because our goal is not to have any. Diabetes. Okay, so I think it can be predicted, and I try and predict this in many of my patients when you first come to see me, and I also think it can be prevented. So the predictive factors are your family history. That is such a great predictive. You ask, who in your families had diabetes? There are many types of diabetes. So we used to tell patients there's insulin dependent and insulin non-dependent. We used to tell people there is juvenile onset or young age onset and old age onset, adult onset diabetes. There's probably more than that. There are probably many types of diabetes, and they happen at different ages. Some people are immediately insulin dependent, some people aren't insulin dependent. It kind of doesn't matter. The idea is just to see what you have and what your numbers show. People who have diabetes with pregnancy or gestational diabetes are definitely at increased risk for having diabetes for the rest of their life. So that's an important risk factor to always address, to know if somebody's had gestational diabetes. Sometimes weight makes you diabetic, but sometimes it doesn't. I have some very skinny people who are diabetic, and that may be not because of their weight, it may actually be their genetics. Diet sometimes, but sometimes it's not a factor. Sometimes I've had a patient who went on an entirely green diet. She ate greens for breakfast, lunch, and dinner. She never had a carb, she never had a sugar. She still had an elevated hemoglobin A1C. And honestly, based on her family history, it was all predictable. She just does not metabolize sugar well. So even though she went on an entirely green diet, she lost 30 pounds, she was super fit, she still didn't cure her diabetes. So sometimes it doesn't matter what you do, it's your genetics. Don't be dismayed, we can only do our best. Blood testing that I usually do is fasting blood sugar, which is somewhat useful, but I find not very helpful in taking care of patients longitudinally. What's easier for me to work with is the hemoglobin A1C. Research trials will tell you the hemoglobin A1C is not as useful. They like to use the oral glucose tolerance test, but anybody who's been pregnant knows that if you do an oral glucose tolerance test, it's not something you want to repeat a couple of times a year. It's too hard to do. You can't drink that stuff and then wait, for 2 hours and do repeat blood testing. It's just too hard, but you will find a lot of the research trials are using that as the gold standard. There's the gold standard versus the real world. In the real world, I think we all know that our hemoglobin A1C helps us. It lets us know, where am I? Am I progressing closer towards diabetes? Am I doing better? And so if we check this number, you can check it about as frequently as every 3 months, because that's the lifespan of a red blood cell. We're counting sugar molecules that coat your red blood cells. So we can check that periodically and give you a hard number. If your number is going up, look in your diet. I had one patient who thought she was super healthy, had a great diet, didn't think she ate sugar. She was eating a lot of dried fruit for fiber. So her sugar intake was really through the dried fruit because it's concentrated sugar. I had another patient who was drinking fruit juices. So he thought he was doing a good thing for himself by drinking fruit juices. But if you look at the fruit juice labels, there's a lot of sugar in those, especially apple juice is really the major ingredient in some of the big long aisle you'll see at Whole Foods of all the fruit juices. So look at your label on fruit juices. Prevention also helps. Foxhall Wellness can help you through a nutritionist. Foxhall Wellness can help you through exercise here at the center. And of course, for some people, medication, like Dr. Yamamoto said, don't be afraid to take a pill. If it's time to take a pill, talk to your doctor about it and see if it's the right thing for you. Okay, the next thing is bone density, because bone density actually is not gender specific. Bone density is for all of us. I wish this projected better, but you can see this is a nice straight spine. It has a little curvature, but as we get older, we get more of the lumbar lordosis, and we get more of the thoracic kyphosis. Until we're older, we're really not straight anymore. We're really starting to curve, and our entire skeleton has changed. So we need to make sure our bones stay strong to accommodate these changes of aging, which are gonna happen. Build your bones while you're young. So you will peak out in your bone density usually around age 30. So that's why I always ask everyone, were you lactose intolerant as a kid? Did you drink milk as a kid? Did you eat your cheese as a kid? Did you hate your milk? Did your mother do a good job making sure you had your milk? Because we all think that that was our mother's duty to make sure we drink our milk. But that really peaks out at 30. So if you are lactose intolerant, if you don't like milk, especially even with your kids, and it's true for both men and women, we all need to focus on that for the first 30 years of our life. Of course it's important to keep doing it 30, 40, 50 years old, but if we try and watch our kids for this, I think it's really helpful. And I talk to young people about to go to college, because we know once they get to the dorms and once they're independent living on their own, they may not drink their milk anymore. And I tell them, if you're really gonna have a crazy diet in college, think about maybe taking a multivitamin with you to college, so that if you aren't getting the dairy products you need, if your diet is crazy, occasionally take a multivitamin. It probably has enough calcium and vitamin D to substitute for what you're missing in your crazy college diet, because who knows when your diet's gonna get back on track. I think for a lot of us, we were much better with our diet once we became parents, and then we started focusing because we were focusing for our children. But in the 20 to 30-year-old age, when it is exactly the time that you want to build your bones, that's when we need to focus on our bone density. Exercise, because it's weight bearing. Again, you can do that at Foxhall Wellness. Osteoporosis, 200 million people is the worldwide statistic, but I'm quite sure it's much more than that. We'll get osteoporosis, which is enough loss of bone density that you have an increased risk for a fracture. And that could be a wrist fracture, a hip fracture, a spine fracture. And the fracture of osteoporosis doesn't even have to be from a fall. You can roll over in bed and crack a vertebra. And that is just from a weak bone just because you rolled over. You don't actually have to fall. So 1 in 3 women over the age of 50 years will experience this. 1 in 5 men will also experience it. Some of this in the men will come from decreased bone density that didn't develop when they were younger. Some men are lactose intolerant. They may not have had enough dairy, but then there's also the component of testosterone. If you have low testosterone, that will also increase your bone turnover. This is the bone density machine. That's all it is. It's just an x-ray machine. This is a picture of joints. This is osteoarthritis. Again, it may not project well. Excuse me. This is cartilage in the joint, and there's nice open joint space. The cartilage here is gone and those two bones came together. This really has nothing to do with this. The only thing they share is the word osteo, which means bone. Otherwise, these things are unrelated. Your osteoporosis doesn't hurt. Your osteoarthritis hurts, but your osteoporosis doesn't hurt until you break a bone. You can start with, as I said, your bone density as early as college. Think about your college student. Do you think they're getting their milk and their dairy? They could take an occasional vitamin. Bone density means the thickness of your bones, and again, it peaks at age 30. The experts in this are endocrinologists trained in bone mineral metabolism and how bones turn over. We don't have a lot of those people in town here. So a lot of the bone density assessment is actually being done by your primary care doctor, gynecologist, rheumatologist. It's just not a specialty that we have a lot of, but those in fact are the people who are the scientists in this area. Usually when we put you on this machine, we're checking the density of your hip and your spine. The next one is blood pressure. Measurement matters. So the reason I say measurement matters, excuse me, is that the absolute number itself is just a number. The measurement matters because there are a lot of factors that go into the measurement. When we are older, as Dr. Yamamoto said, we will have a stiff pipe for our arteries. When we are younger, this is a balloon, This is an expanded balloon full of air. When the air goes out of the balloon, it shrinks down. Your artery can do that when you're young. Your artery has a hard time doing that when it's old. When it's older, it's going to do this. And that creates a blood pressure phenomenon. Here, the pressure can go up and down relatively easily because the air goes in and out. Here, there's a static force that's preventing the pressure from changing. Your artery got stiff. Blood pressures are different across your lifespan. A teenager typically is going to come into the office, and a normal blood pressure for a teenager is 90. If you're 80 years old and you have a blood pressure of 90, you may be fainting every day. But at 15-year-old, they do fine with a blood pressure of 90. That's normal for them. At 50 years old, your blood pressure has a different meaning. At 100 years old, your blood pressure has a different meaning. And some of this is due to a teenager's stretchy arteries that are what we call compliant, or an 80-year-old stiff arteries that we call non-compliant. They're stiff. The blood pressure can't go up and down as easily. More often than not, it's just going to be up. The cuff matters. This is a wrist cuff. I don't like these. I've told you not to get them. They're unreliable. They're unreliable for use at home because they're not accurate. An arm cuff is better if you're going to use a blood pressure cuff at home, but typically as you get older, even this measurement on the arm cuff will be a little bit unreliable. So I often have patients bring their cuff into the office so we can look at it together and do the blood pressure on their arm cuff in the office so you know what you're getting at home. So your doctor does matter because you can tell me what your blood pressure is, but if you are not in the office with me and we are not looking at your numbers together and I don't know where you are in the spectrum of stretchy arteries to stiff, I can't tell you what that blood pressure means. I need to see you and talk to you. So your doctor interpreting your blood pressure makes a difference. Blood pressure is not just a set of numbers. It's not a disease. It has to be contextualized. And so the context is, how old are you? Do you have a stiff heart? Do you have kidney disease? How much salt do you eat? There are a lot of things to contextualize blood pressure. So that means a number of 120/80 is very different depending on who you are and what other problems you have in your body. So talk to your doctor. And if it gets too complicated, don't talk to Dr. Google. Talk to a specialist because kidney specialists actually know about blood pressure and cardiologists know about blood pressure. Next one is exercise. 3 types of exercise I like to emphasize are cardio, strength, and flexibility. Flexibility yoga, strength weightlifting, you don't have to do that. Cardio, I think a lot of people know what this is. I'm not advertising for them, it just is a good picture. And then Kenzendo and martial arts combines cardio, strength, and flexibility. So it's a nice way to get all 3. But if you try to do all 3 types, you don't have to do all 3 types every day, but if you try to do all 3 types, this is prevention. Strength training is obviously going to prevent you from losing muscle strength in your pelvis and your legs when you need it when you're in your 70s, 80s, and 90s. Flexibility is going to prevent pain because if your hamstrings aren't flexible and your glute muscles aren't flexible, you will have back pain. We all know that. If you've done physical therapy for back pain, you know they're focusing on hamstrings and glutes. Cardio, well, that's everything else. Your blood pressure, your heart rate, your level of fitness. Can you go up and down the stairs? Next one is sinus node function. Dr. Yamamoto talked about the sinus node. I'm just going to tell you it's not just the sinuses in your face. These are the sinuses in your face. The sinus is an opening right there. But there's a sinus node in your heart. Here's the heart. Here's the sinoatrial node. So when we say sinus node, we mean this electrical tissue in your heart that changes in particular with age. We know it changes with fitness level, but there are some serious changes that happen to your sinus node as you get older that we really should pay attention to because it could go too fast, it could go too slow. Basically, it's kind of unreliable after 50. It's pretty reliable from birth until about age 40 or 50, but for most of us, it's going to start changing. It's just another thing to talk about with your doctor. Heart rate does matter. There's a misconception that Dr. Yamamoto and I run into all the time that your athlete's slow heart rate means that you are healthy. It's different at every age. It's nice to have an athlete's slow heart rate when you're young and you're athletic, but does that also apply to when you're 80 or 90 years old? Does an athletic heart rate of 48 actually mean you're getting blood to your brain when you're 80 years old? It might not. Finally, everybody doesn't always feel their heartbeat. As Dr. Yamamoto said, a lot of atrial fibrillation is asymptomatic. And it's not even just asymptomatic, but it's paroxysmally differently symptomatic. You might have dizziness. You might have shortness of breath. There are a lot of ways that your heart beats irregularly and manifests in different symptoms. 100% of people will slow down with age with their heartbeat, but they probably won't feel it until it's too late. So you may wonder, why am I fatigued? Why am I slowing down? There's a way we can find out if your heart rate is too low for you. But again, you may not feel this. Even if you just go into the doctor for a physical, we'll tell you what your heart rate is and if we think it's appropriate for the activities that you're doing. But pay attention to heart rate, because it is, again, something that needs to be contextualized. It's very specific for your health status. One more thing about heart rate. I just used this slide, which I stole from Dr. Yamamoto, just to demonstrate that blood goes through the carotid arteries to the brain. You need a heart rate, not just a blood flow, but a heart rate to pump that blood up there. So knowing what your heart rate is, and is it enough to pump blood to your brain? Is it fast enough? Is it adequate enough? Is a part of the heart rate analysis. Next thing quickly is hormonal. There's a lot to say about hormonal. Endocrine is what we're talking about, the endocrine system when we talk about hormones. Your thyroid gland, I just found somebody this week who has hypothyroidism. It runs in his family. It's not super typical for men, but everybody in his family has it. He's 50 years old. For him, it was completely asymptomatic, but sure enough, he has Hashimoto's thyroiditis, which is the basic term for autoimmune thyroid disease. Pancreas is also part of the hormone system. We have hormones coming out of our pancreas, ovaries, testes. Why do we think that this is important for your building blocks for your health? Why does this stabilize your pyramid? Because you need both enough testosterone and estrogen to support your muscle mass. I saw another patient this week. All of his blood tests were entirely normal. The one thing everybody noticed in his family is that his chest is getting thinner. His arms are getting thinner. He's losing muscle mass, and he's 80 years old. One thing we should look for in people who are losing muscle mass is there a contribution from decrease in hormones? Men decrease their testosterone just like women decrease their estrogen. So if that is part of the problem, that muscle mass is going down, a man with osteoporosis, a man with a decreased mood, anemia in women would be estrogen through menstrual cycles. Women after menopause don't use that as an explanation for anemia. If a woman is anemic after menopause, that's a medical problem. It's acceptable if they're young, we expect that. If a man is anemic, one of the causes could be low testosterone, because testosterone is a potent stimulator to the bone to make red blood cells. And the last one is thyroid. It seems kind of simplistic that we check your thyroid blood test almost every year we do your physical, but there is so much hypothyroidism, and it really does run the machinery of your body. So if you have not had your thyroid blood test checked, it is still acceptable to check it every year, because this will pop up all the time, and it's easy to treat. Last one is diet on this level. Dr. Yamamoto and I are working on this. This is conceptualization for diet nutrition for the next book. And so we wanted to call it, at least now we're calling it genetic metabolic matching. Some of it has to do with ancestry. Where did you come from? What can you metabolize? For example, there are counties in Ireland where the gene for celiac sprue or gluten allergy is extremely strong. 50% of the people there in these particular counties in Ireland have the gene for gluten allergy. So that's a very strong ancestral factor. And here in the United States, given the number of people that we have coming from different locations around the world, it's important to integrate that into what should my diet be. We'll have a nutritionist who can focus on some of that with you. There's also some spontaneous, I'm calling them, metabolic genetic changes. Not everybody is born with gluten allergy. For some people, this gene will turn on as you get older. I diagnosed somebody with celiac sprue gluten allergy at 70 years old. He was half Irish. He didn't know his whole life that he had celiac sprue. He had been eating gluten his whole life. The way I diagnosed it was that he was anemic, and he had a normal endoscopy. So we just checked the tissue transglutaminase antibody level, and he had celiac sprue. He didn't know he was not supposed to be eating gluten. This is not uncommon to find suddenly in somebody's 50s, 60s, 70s. Alcohol sensitivity, there's the enzyme that gets rid of alcohol. There are some people who don't have enough of that enzyme. So when they drink alcohol, they actually get gut cramps, flushing. They don't metabolize alcohol. There's another one called an acquired allergy from alpha-gal, which is very sad and unfortunate. It's when you get bitten by a Lone Star tick and develop an allergy to red meat. That is an acquired allergy, and it'll give you hives, and for some people, it's actually rather serious. So we actually have to tell them, you're not allowed to eat any red meat anymore because you now have an allergic response to the proteins in red meat. Tree nut allergies, I think we all know about. Oral allergy syndrome is on the spectrum of allergies that may be for many people mild, but if you eat green beans and you get mouth tingling and numbness, or if you eat the skin of fresh cherries or peaches and your mouth tingles and your throat starts to get itchy, you don't want to eat that anymore. Yet you still want to eat fruits or you still want to eat vegetables. This is going to dictate what you can eat nutritionally if you have side effects or reactions to food, and they are actually pretty common. Lactose intolerance is a big one again, because if you're lactose intolerant, you have to find another source for calcium and vitamin D. Mental health, I don't really think I have to say too much about mental health for the past 18 months, but we can also help you at the Foxhall Foundation with your mental wellness, especially with exercise. I bet everybody today leaving from the demonstrations with Mr. Ricky and Ivan is going to have a boost in their mental wellness, even just for having watched that, much less doing chair yoga with Tala. I think we all can get a boost in our mood just from exercise. So don't forget that part of your mental wellness definitely is that boost you get from exercise. Even when I don't want to come to bow class on Friday nights, I tell myself, you know that when you are done with bow class, you're going to be a much happier person and you're going to feel better ending your week if you go to bow class. So I go and I do feel better, and I'm certainly not one of Ivan's best students, and I certainly can't concentrate very well on all those moves, but I do it and I always feel better. Mood disorders have been completely exacerbated in the past 18 months. Those definitely have to do with your wellness, because if you're having an exacerbation of your mood disorder, that certainly affects your overall health. Social interaction, we definitely know, is a big factor in whether or not we have mental wellness, but you can also get that through the Foxhall Foundation. Endorphins have a lot to do with it. How do we create our natural endorphins? And then sleep. And sleep has suffered so much in the past 18 months. A lot of people are having a very hard time, and that contributes to your mental wellness. Last one is skin. We'll make this really quick because I'm not sure where I'm going with the skin, but we'll just do some quick images. If you have something that changes on your skin, it's asymmetric. The borders are starting to look irregular. The color is starting to look off. It's not skin color, it's too red. The diameter is expanding and it's changing. It didn't look like that a month ago. That's a melanoma, that's a squamous cell carcinoma, that's a basal cell carcinoma, because there's a shiny heaped up edge. Unfortunately, because people didn't get to the dermatologist in the past 18 months, we're seeing a lot more skin cancers recently, as we are a lot of other disease processes. So just keep an eye on your skin. And finally, just to end the talk, what happens if you don't get an immunization? Your entire pyramid will tip over. And clearly there's one immunization that we all need right now, and it's that radical. You can radically shift your overall health. Doesn't matter how well you've built this pyramid. If you don't get a COVID vaccine, your pyramid is doomed. So I don't think I have to say that in our county, but clearly other parts of the country still don't understand the importance of immunizations. That's the first book. We'll work on a second book. That's our foundation. And that's it. Thanks everybody for coming.